Consider Cannabis is not intended to be a substitute for professional medical advice, diagnoses, or treatment recommendations. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition.
I've spoken with a parent that was on the verge. They're like, I don't know what to do. I'm about to put my child in a group home and I don't want to do that. Like, please help me.
It's time to consider cannabis. This is Curtis. This is the 40th episode of Consider Cannabis. Today we'll be sitting down with nurse and entrepreneur Vanessa Peck. She has recently opened Elevated Healing to help people navigate the cannabis space and to find the best treatment possible for patients who have tried everything else or are just looking for something a little more natural. We will hear about the journey that led to her eyes being open to the medical properties of cannabis and discuss autism, treatment-resistant epilepsy, pandas, and more. So let's sit down with Vanessa Peck and we'll consider cannabis together. Vanessa, thank you so much for joining me.
Thank you for having me, Curtis.
So you are a pediatric nurse.
I'm an ER nurse. I do both adult and pediatric. I'm an ER nurse.
I'm sorry.
That's okay. And I do both adult and pediatric.
Do you prefer one or the other?
I really love pediatrics, but I love it all, really, at the end of the day. But pediatrics is a interesting specialty. It is fun and it's very different than doing the adult side of the ER. So it's a whole different skill set, really.
Yeah, I'm sure. Absolutely. Because some of those kiddos can be a handful.
Yes.
Absolutely. But tell me, when did you first know you wanted to get into medicine?
Yeah, so I actually had a bachelor's degree already in business, and I always knew that I wanted to help people in a different way. It kind of was a different path that I kept taking, knowing that I wanted to help people, but I just didn't know how. And it wasn't until I had a family member that became really ill and had a bad accident, became very involved in the medical side then. And then at that point, I quit my job and went back to nursing school. And that was about 14 years ago. And I have been an ER nurse since.
In that process of going through medical school, how much did you learn or hear about medical cannabis?
Heard nothing about it. It wasn't until a few years ago when I was working in the pediatric ER that I specifically had a patient with autism. And they were there for symptoms that mom and dad were concerned about. And mom had told the ER doctor and I that if the child were to be admitted, that we could have quite a bit of a meltdown with him once he found out. So we're kind of hoping that he didn't have to be admitted, but unfortunately, it didn't turn out that way. And he did exactly what mom said he would probably do once he found out. And when mom had to tell him that he had to stay overnight in the hospital, he just really lost it. He was pacing back and forth in the room. He was yelling a lot, just very upset. And the ER physician had pulled me aside and said, listen, I'm going to order some IV Ativan, which is a sedative that you can put through his IV if we need to. And I let mom know that. And mom said, let's keep that, on the side in case we need it. But I do have his CBD oil. And if you guys would be okay with me giving it to him, it tends to work in 15, 20 minutes. And it usually works in situations like this. But in case it doesn't, let's keep the Ativan on hand and we'll give it then if in 20 minutes he's still doing the same thing. So I let the ER physician know, and she was very accommodating about it. And she said, sure, let mom give the CBD oil. Just know that you have the Ativan and we'll go from there. So I went about my business taking care of my other patients. And I would say probably about 20, 25 minutes later, I decided to go check on them and see how they were doing. And as I approached the room, from what I heard when I left the room, it was a drastic difference. It was quiet. And I walked into the room and I think mom could see my face already, like, oh my gosh, what? And he was laying in bed there, watching TV, laughing with his parents like nothing had happened. And I think mom could just see it on my face. And then we had gotten into a conversation about, how they started using CBD oil, why they did, where they heard about it. And mom had kind of given me just a small story about how, they had been through the ringer over the years on several medications. One would work, one wouldn't. When one did work, then it had side effects. Then it was another medication for those side effects. She said it was just a horrible experience. And she was in a lot of support groups for autism spectrum disorder. And she had heard about CBD and some people having some success with it. And she had done her research and decided to try it. And she said it's been a godsend for them. and that it's just really helped their son. And they've seen him in a better light with the CBD than when he was on all the other heavy medications with the side effects that just made him drowsy or a zombie. And mom had said, she said, I swear by it. It has changed his life and our life. And she said she was even using it for her mother with dementia, who was having increased sundowning, which are these episodes of increased confusion. And she said it was working great for her mom too. She said, I swear by this. She said it works for so many things and it's really changed our lives. So that's how I really got into the cannabis, or really started understanding it and really doing more research on it.
So walk me through it, if you will.
Sure.
That moment when the mom says, "I have some CBD oil that I want to give to him if that's okay with you." Like, what was going through your mind as a nurse in the hospital without any sort of background on the medicinal uses of it?
Sure. Yeah. Like I said, I was naive to the information then, so I didn't really know what to expect of it. But when you work in the pediatric ER, especially pediatrics as a nurse, even though I have a lot of medical knowledge in what we do and what we use and our protocols, at the end of the day, when it comes to children, parents know their kids best. So, and especially in a situation when a child has autism spectrum disorder, we had seen a lot of people and families who had children with autism spectrum disorder. And sometimes we had to take the guidance of the parents, like what's going to work best in this situation. It's an environment that's confusing and different for them. So you take the guidance of the parents. So sometimes if a parent says like this is going to work, then as a nurse or a physician, sometimes we don't always know best. The parents know best. So at that point, it was kind of just a teaching moment for me, and for me to kind of retrospectively respect what the parents do for their child with autism spectrum disorder. It's not the same as a neurotypical child having a quote unquote meltdown. It's a bit different. So at that point, you were just open, and as long as I was open and the physician was open, it was just going to be a great teaching moment for all of us. So that's kind of what was really going through my head, and then just use it as an opportunity to learn more about it.
Were you expecting the physician to be open because of that same sort of reasoning that parents know their kids?
Definitely. And the physician that I was working with that day, she tends to be more open about a lot of stuff. I wouldn't say that would have been the same situation for all physicians that I might have been working with that day, but on that particular day, it was a physician that just understood. She's like, hey, yeah, the parents know best. Let's try it. And if it doesn't work, know that you have this other medication on hand if need be.
That's good. Yeah, I'm always curious. I mean, my son is autistic. He's 11 years old. I don't give him CBD. I don't give him teach. I don't give him any. He doesn't have a recommendation, and he's resistant to us giving him stuff. Like he's always kind of hesitant. If you're like, "Are you trying to put something in my drink?" Like, "What is this?" "No, I don't want to take this." "You want me to have it?" "No, I don't want it." So it just really hasn't really materialized for my son in our context, but
Right.
I've always been curious, like, what a parent would do in that situation, I mean, obviously, because of the federal legalities of it, then, you don't necessarily want to be telling people of authority that, you're giving your kid cannabinoids because all of a sudden, even though I know what I'm doing, it doesn't necessarily mean that they understand the difference or the proper way to treat it and the
Mhm.
medicinal uses of it. Yeah, so I was just curious.
Yeah, it's very true. It's a fine line. It's very trepidous for parents. And I think cannabis or using cannabinoids is not going to be for every parent that has a child with epilepsy or autism spectrum disorder. I think it tends to be on the more extreme end of things where, the conventional just has failed them over and over. It hasn't worked. These parents are at their wits' end, and all the alternative options that they've looked at, one seems more promising than the next, but they're just unsure as to where to go, and they're really just desperate to provide relief to their child. And I think this is
Yeah.
a lot of parents that have had their children on a lot of other traditional medicines that have just really turned out very poorly for them because it's just had bad side effects, or they just haven't worked, and their poor child is just doing a lot of self-injurious behaviors, has really bad OCD, bad anxiety, to the point where it's just deteriorating everybody's lives, the child's life, the parent's life, and everybody's just looking for help.
Yeah, yeah, absolutely. I can relate to some of the things you're saying there, that's for sure. What do
I'm
you
sure.
what do you see in the medical community today, 2020? I mean, obviously everyone's crazy about COVID, and rightfully so, don't get me wrong. But in the world of cannabis and in that space of medicine, it seems like with all of the information that's coming out of Israel and coming out of these places that are doing the studies, does it seem like the doors are opening in the medical community to cannabis?
Yes and no. I think there are a few doctors that are ahead of the curve and they see the benefits of it and they see the studies, where they're coming from both the conventional and alternative side, where they realize, hey, the conventional doesn't always work for everybody, but this is an alternative that does. But I don't think it's very accepted because even though there's these great studies coming out of Israel and some other countries that are much further ahead than we are, people will say, especially in the medical community, well, it's not a study that's being conducted in the US. It's not our information, our studies that we're conducting. So even though they see these studies coming out, they're saying, yeah, there's some legitimacy to it. But again, it's not a study that's being conducted in the US. So, are there the way they do studies, is it as rigorous as ours and vice versa? So I think that the barriers and the obstacles here in the medical community still exist and that stigma still exists. Although I do think there are some doctors that are very much proponents of it and trying to forge forth by showing people there are studies and scientific evidence there, and I'm using it with my patients, and I'm having great outcomes, better outcomes than when I was just prescribing these sedatives or these opioids. And now here they're using more of a natural component of cannabis and they're having greater benefits and feeling better. So I think with time we're going to see those walls come down, but it's going to take more studies and more evidence in the medical community here in the US to really get more physicians behind it.
Yeah, and that leaves us right back to where we are now with the federal prohibition of cannabis making those studies impossible, which leaves us in this deadlock and parents like me just pulling out what little hair we have left.
Yeah, exactly.
So, what moved you to open Elevated Healing? Tell me about it and, its mission, vision, all of it.
Yeah. So, working in the ER for the last 12 years, I've seen conventional medicine work at its best in the most acute situations. But I've also seen conventional medicine fail a lot of people over and over again, where we have what we call revolving door patients, patients that, you're in on a Monday and you're seeing them again on a Wednesday in the same situation or worse off than they were on Monday. So conventional medicine has its time and place. I'm not saying conventional medicine's bad at all, but having something alternative, more natural, something that supplements our body with a system that exists with, these endogenous cannabinoids that are work parallel with the phytocannabinoids in cannabis. There's something to be said about that, and the fact that people are having better outcomes, whether it's pain control or it's behavioral issues with for parents who have children that are severely autistic on the spectrum, treatment resistant epilepsy. We're seeing people given quality of life that they've never had before, even when they were on the conventional medicine. Sometimes the conventional medicine just makes people feel worse, or they're having side effects that are making them worse. And then they're taking another medication. I mean, some of these people, some of these parents with children, the amount of medications that they're on at a time, as a nurse or a healthcare professional, you have to stand back and you're just amazed by it, and you wonder how people are even able to function throughout the day with the amount of medications that they're on. So be able to explore an alternative and teach people about the science and the evidence behind it, and that this is a real option for a lot of people out there, whether it's adult, pediatrics, just to be able to give people a quality of life that they really want. That's what it's all about. So that's what made me explore cannabis more, made me want to open up my own business to help teach people about this, and just help as many people as I can. I mean, that's why I went into my profession to begin with. I want to help people. And while I feel like I am in the ER, it's very short term. And sometimes you feel like you're really not helping people the way you could, because if you were with that patient on a Monday and they're back on a Wednesday, you just feel like all I'm doing is putting a Band-Aid on things. Is there something else that I can do that's long lasting, that you can really teach people about and is more natural? Then, it's like a win-win situation for everyone.
Yeah, so you're currently still working as an ER nurse while opening Elevated Healing?
Yep, I am. So I'm doing ER, but I'm also doing infusion nursing. So I'm doing that while I'm also doing my business as well.
Okay. All right.
Yeah,
Very cool. Keeps you busy, I bet.
very busy. There's never a dull moment.
So someone like me, I've thought about cannabis, obviously use it myself for my medical needs, and do see that it has some benefits for people with autism, and having a son with autism, it just seems like a no-brainer that it works for me, that it would be beneficial for my son as well. But what are some of the things that a parent like me should really consider when thinking about implementing this for their child?
Sure. So I think when it comes to parents exploring this for their child, I think there has to be a lot of education that needs to go behind this, just so parents can really understand, the safety and efficacy of it. Are there side effects? There's side effects to everything, and whether or not people are going to experience that, it's different for everybody because everybody's bodies process things differently. So, I mean, I could take something and I had no effect to it, and then you take it and you had X, Y, and Z side effects to it. The same thing can happen with a child. The side effects with cannabis, they are there, but they're minimal in comparison. Can it affect another child differently than others? Of course. But it's like anything. Most side effects with cannabis would be like fatigue, dry mouth, could be some GI symptoms like diarrhea. And whether or not that's going to happen, unfortunately, it's still like a trial and error because as more studies are being done, we're discovering more of this stuff. But I think every parent needs to know that it's still safe and effective, but it's also an art that even though there are studies, we can't pinpoint exactly what cannabinoid or combination of cannabinoids is going to work best for each child. People are going to react to it differently. And then sometimes you need to put the THC on top of it, which is a huge concern for parents too, because I think when people hear cannabis, they just automatically think high or THC. That's what we tend to associate with it and the stigma of it. But to teach people that it's also not just about CBD and THC, but there's a whole cannabinoid profile that's beneficial to people, whether it be CBG, CBN, the terpenes. This is all stuff that people don't know about. And maybe sometimes we don't even need CBD. There are companies out there that are just making terpenes, period. And maybe sometimes just the profile, the terpene, or the effects of the terpene is what's going to help some of the symptoms that maybe a child is having and parents are looking to quell or alleviate. But I think if we keep teaching people the science behind it, the evidence that is there, why it works, the endocannabinoid system, just on a high level, I think people, when they wrap their minds around it, that stigma comes down and people are more willing to try it. I mean, we're so quick to take a prescription from a doctor, but we don't always necessarily know what the side effects are there. And we're putting something synthetic and unnatural in our bodies or in our child's bodies with just the hope that we're going to help the symptoms. But here we have something natural that can do the same thing. Are there side effects? Of course there are, but they're minimal in comparison and you don't see them as often.
So you hit on the thought that it's just about THC or getting high, and that there's all these different profiles. And it's interesting. I mean, I guess it's just the way the science has gone that we've discovered CBD and it's become what it has become. And I'm thankful that that's happened. But CBD alone isn't a solution for me. And we have a family friend who has a small child who was put on Epidiolex and ended up having just a really bad reaction, some GI issues that were not sustainable. So, in that sort of situation, if someone had an experience like that, should that turn them away from the idea of cannabis as medicine for that child? Because I've heard that the amount of oil that they use as a carrier is something that has caused children to have an issue too. And now I'm not expecting you to be an Epidiolex expert or anything, but just in if you had a parent who said, "Whoa, this is happening," like, what would you do? What would you suggest in that sort of situation?
Yeah. And I could totally understand as I would definitely be trepidatious as a parent after having that experience because now here you're turning to something that's a synthetic form of CBD, expecting it to work because it's worked for so many. And now you have this horrible side effect that just, like you said, is not sustainable. And if it was the oil part of it, and there are children that do have issues with just the oil based part of it, but there is cannabis out there that's water soluble and and not oil based, that maybe they wouldn't have those type of effects GI wise. So, I mean, there are other options. It's just whether or not the parents are willing to try again, because it really is an effective form of treatment that can really help, especially in the case of your friend who has a child with treatment resistant epilepsy, where CBD or the synthetic form of CBD, Epidiolex, has really been successful in stopping these seizures for many of these children with severe forms of epilepsy. But there are other tinctures out there that can be used that are not oil based and they're more water based. I mean, there's even nanotechnology out there for some products that are high end products that are organic, that have been rigorously tested, that would actually bypass a lot of the way the body processes something that's oil based. The bioavailability of it is even greater, works quicker, and now you're not going to see some of those issues that you would with some oil-based products, where it needs to go through the liver. Kids are getting GI issues, or even adults getting GI issues. Some of this water-based nanotechnology can actually prevent that from happening. So there are other options out there, but I can understand a parent being trepidatious after their experience, for sure.
Yeah, I mean, there's only so much you want to put your kid through, but at the same time, to be doing everything you possibly can and making no ground to help your kid is a rough place to be as a parent.
And there are a lot of parents out there who just feel at their wits' end. They don't know what else to do. They feel helpless at that point. So
Yeah, it's just okay. So I know that cannabis can help people with Crohn's disease and IBS, and
it almost seems counterintuitive how it can
yeah,
help people who have issues like that, but yet cause issues in another child like that. And I don't know if it's related to maybe just the oil itself. I do know that in the cases of some children, and I know this is different because it's not treatment resistant epilepsy, what I'm about to speak about, but some children with autism spectrum disorder, sometimes they have a lot of immune issues as well. And then if you put them on cannabis right away, they actually can have the reverse reaction where it actually makes them worse off than better. And there have been studies that have been found that sometimes detoxing a child first with certain, like, kind of a nutritional type diet where we kind of detox the body first and get the immune system up and running better, then they tend to respond better to a cannabis treatment option. Whether or not that is the case with this child, because you have to remember too, our gut is our second brain, and the majority of our immune system is within our gut. So I don't know if this child's had a lot of infections over time, whether it be colds or viral infections or strep throat, anything like that. If they tend to, if there is a child that has a chronic condition and also tends to become ill frequently, sometimes they can actually have a adverse reaction to cannabis and not respond to it as well, causing more issues. And there's been studies that have been done that saying detoxing first and doing, kind of approaching it in a nutrigenomic way, kind of, if we just like clean up the system a little bit better, then they tend to respond better to the cannabis.
That's interesting. That's interesting. And I mean, I know that, our endocannabinoid system is so complex that when you add cannabinoids to it to treat one thing, it's very well possibly can affect something else. So if you're using it to try to treat epilepsy and seizures, it could have an effect on your digestive system that you weren't expecting. And
Mhm.
yet, I don't know. I guess I'm just still frustrated because I know that if we had more research behind it, we could probably get an idea, a better idea as to what's causing that and how to work around it.
Right. And that's the frustrating part, being able to do that research. And that's why we need so many more people to continue to be proponents about this, to help deschedule, medical cannabis. I mean, here we have Epidiolex, which is a Schedule 3 drug, but it's a synthetic form of CBD. But somehow medical marijuana remains a schedule, or cannabis marijuana remains a Schedule 1 drug. How is that possible when we have a synthetic form of CBD, Schedule 3, but then marijuana remains a Schedule 1? It makes no sense. But the fact that we're denying so many people out there to have access to this freely is mind-boggling, when we have pharmaceutical companies making synthetic forms of THC for a lot of cancer patients who need the antiemetic, the anti-nausea form of the anti-nausea properties of THC. because other antiemetics are not working for them. And then here we have a synthetic form of CBD for children who have treatment-resistant epilepsy, severe forms of epilepsy. It just makes no sense.
It really doesn't. Since opening Elevated Healing, what are some of the positive effects you've seen cannabis have on families?
Yeah, so definitely I've seen some parents have some success with a child with autism who's had self-injurious behaviors where it was really very detrimental. I mean, parents literally scared for their child as they, have harmed themselves for many hours at a time and just couldn't get them to stop. And with some of the combination of the CBD that we've used, parents have seen their child calm down, and to them, it was a huge part of having a better quality of life to be able to leave the house now without their child having a meltdown. Just people saying that they're like, I've never been able to leave the house. I've never been able to go to the food store with my child. And now we're going and not even having any issues right now. So we're seeing it. More parents are wanting to explore it. So most of my conversations are just teaching them. They're still sitting there thinking about whether or not they want to move forward with it. And I understand that. But as long as we keep getting the education out there and letting parents know that it is a real viable option for them, and that doing it together collaboratively between a parent and a healthcare professional, we can do it safely and effectively. So, with time, I think we're going to see more parents really exploring this option. And slowly it's happening.
Yeah, you kinda hit a nerve there with the self-injurious behavior with me. I actually just went through a behavior intervention kind of deal with Children's Hospital locally, and it was
Mhm.
really good. It was a great time in the building. Transferring it to the house has been a different experience altogether, but my son, God bless him, will just bang an iPad against his head, it is
Okay.
and break it, and then, like, go run his head under cold water because like, you give him the impact mat or something to do it with, and he doesn't want it because it doesn't give him the same sensory input, and it's just heartbreaking
Yeah,
to me, and you go to help him, and then he pushes you away or hits you or goes off and bangs his head on the floor, and it's just, yeah, anyway,
it's
so
really hard.
I can relate to those sorts of what do you do? Yeah,
Right.
yeah.
It's very hard, and there's a lot of parents out there that are dealing with that, and they're trying everything, all different therapies, just trying to figure out what works sensory wise for their child, the stimming. It's very difficult, but at some point when it feels like nothing else is working, you know and these parents are very educated, they research, they know their information, and they're willing to be open to alternatives, but they also want to make sure that they have the right information before they go and do anything to possibly help their child. But they're all looking to really help their child. And like I said, it's a spectrum, so everybody's on a in a different boat, but it's the more severe cases where we're just like, nothing else is working. I need something. And it's to a point where I've spoken with a parent that was on the verge. They're like, I don't know what to do. I'm about to put my child in a group home and I don't want to do that. Like, please help me. So there are desperate cries out there. And these are the parents that I want to help. I don't want to see parents have to put their child in a group home. That's the last thing a parent ever wants to do. So if I can help prevent that and give quality of life to that child and to the parent, and the parent be able to see some sort of future for their child, that they can do things independently because now things are under better control, then that's my goal. That's what I want to do, is help as many kids and parents as I can.
When we first started communicating, you mentioned, pandas, and I was wondering if you could speak a little more on pandas and what effects you've seen cannabis have on people with pandas.
Yeah, so I unfortunately haven't had the chance to work with anybody with pandas, but it's out there. And I did have one mom reach out to me saying that she was considering cannabis because she was having some extensive issues with her child. So pandas is a short term for a very long term. It stands for pediatric autoimmune neuropsychiatric disorders. And what it is children who are coming down with strep infections, whether it's strep throat or scarlet fever, some sort of infection that's caused by strep. These children are now developing very severe OCD, tics, tremors, and they never had these issues prior to the infection. It's happening after the infection. There is a lot of controversy around it, but there are a lot of studies behind that the strep infection is causing this in this children. These children are getting better, but it's taking months on conventional treatments. And then there are some children who are taking these conventional treatments and it's just absolutely not helping. So just the OCD and the tics, the cannabis has been found to potentially be promising to help reduce the OCD and the tics. So that's why I wanted to explore this for parents as well, because it is a issue where some people don't really believe that the OCD or tics is coming from the strep infection, where there are studies that are showing it. And then these parents are at their wits' end as well. They're like, my child was fine before the strep throat or before the scarlet fever, and now all of a sudden they have high anxiety, OCD, these tremors and tics. This has never existed before. So it's something that I'm willing to help parents with, to explore if they're not finding relief from the conventional treatment after this diagnosis of PANDAS. And once a child has one strep infection and they're diagnosed with PANDAS, even though if it could get better in a few months, if they get a strep infection again, there's a great likelihood that they'll end up forming this OCD, tics, and tremors again with the strep infection. So it can really leave parents and the child really debilitated, going from normalcy to not normal and just having these high anxiety issues. And cannabis can be pretty promising for it.
Have they seen those symptoms get worse with continued strep infections, or is that not something they've really looked at?
I don't think they've really looked at it. I think it's pretty much similar. So if it happened in one case with the first strep infection, it's pretty similar if they end up having another strep infection. But I can tell you that it panics parents because, here kids are in school getting strep throat or a sore throat or a viral infection is very common with
Yeah.
everybody in close quarters. And so I know it really puts parents in a panic as well. Like if they finally are relieved of the symptoms and now, winter season comes around again, parents are just like, please, I don't want this to happen again. It was horrible for my child and watch my child go through. And I just didn't know what to do. And I didn't thought it was going to be never ending. They're pretty much at their wits' end too. Like I said, they go from seeing a normal child to something completely different. It's panicking. To be able to provide a possible option for parents to explore if the conventional didn't work for them and they fall into this situation again, the option of cannabis and using CBD or a combination of a full spectrum can be really helpful.
Yeah, absolutely.
Yeah.
Vanessa, thank you so much for taking the time to come on the show and talk to us about cannabis. Is there anything else you'd like to say to our listeners who are considering cannabis today?
Yeah, I would say make sure you're just informed before using it. Talk to a healthcare professional that knows about it. If you wanted guidance, there are people out there that can help you navigate through the world of cannabis, where you can learn what it's about, why it would be helpful for your child, how it works, and how you go about using it. And somebody can guide you, as to what cocktail of things could possibly work. That's what I do at Elevated Healing, that if parents were looking into it, they can most certainly check out my website, elevated-healing.com. I can help guide them through it, or even just answer a couple of questions before they even decide if this is a route that they want to go. At the end of the day, parents need the right information so they can feel confident in making the best decision for their child at the end of the day. And that's where I come in and want to make sure that people are well informed and together decide, is this really truly an option for your child and your family?
Awesome. All right. Thanks for joining us.
Cool. Well, thank you for having me.
No parent wants to sit and watch their child suffer while feeling helpless. The inability to provide my child aid from his ailments has caused me to rely on my faith for sanity and any hope for relief. Could cannabis be the piece missing from my son's treatment plan? While I can't force my son to take any medicine, it is clear to this parent that it is past time. We are running late. We should already be diving deep into the complexities of this plant to unlock all of its potentials.
If you would like to be a guest and share how cannabis has impacted your health and wellness, send an email to considercannabisnow@gmail.com. You can also reach us at our website, considercannabisnow.com, where you can find all our previous episodes, as well as links you can follow to our Instagram, Facebook page, and more. If you have found anything of value on this show, please share it with someone else. Remember to subscribe for free and get every new episode delivered right to your phone. Thank you for listening. Join us next time as we consider cannabis together.